We've made this short video to show the ongoing work of the MSK Physiotherapy team within the Southern Trust during the pandemic. Our team is continuing to adapt and work hard to provide a physiotherapy service given the radical changes that have affected all aspects of healthcare provision over recent weeks. This is our current team of senior MSK clinicians working from a base at Banbridge Health and Care Centre. Our team normally provide MSK physio across 10 sites in the Southern Trust. We are now coordinating all of our work from Banbridge with a few staff working via remote access from home. From the week beginning 16th of March, all of our physiotherapy outpatient appointments were cancelled and the service stood down. This involved 50 physiotherapists and assistants reviewing their caseloads, identifying the patients who could self-manage with detailed personal rehab programmes, or those who may need further follow-up. This has therefore had an impact on a huge number of patients. There are still a significant number of patients with active care episodes who require input, and we are endeavouring to follow all of these patients up via telephone. Inside the physio department, our waiting rooms and gyms are empty as staff adapt to new ways of working while continuing to provide treatment, albeit in a different format. This has been challenging as our workforce has been significantly reduced in number. The majority of MSK staff were urgently redeployed to acute and community settings to help with current demands and prioritisation of services. It has also involved a considerable change in practice for staff who are used to face-to-face consultations and a hands-on treatment approach with patients. We have adopted a shift pattern of work to allow staff on duty access to the resources they need, such as computers and telephones, to carry out their work, and also to comply with social distancing guidance for staff. We continue to liaise with fracture clinic and emergency department staff to ensure continuity of care. Due to the ever-changing situation, we now have redeployed staff returning from acute and community teams who will be working from South Tyrone Hospital.
Our daily work involves triage of urgent referrals, telephoning patients to check on their progress, providing expert physiotherapy advice on their individual condition, and addressing any concerns or questions they might have. Exercise programs are updated and posted out to patients to allow them to advance their rehabilitation and work together towards improving physical health. Many patients have expressed understanding of the current circumstances and the pressures which face healthcare staff and services. They appreciate a telephone call, especially during these anxious times when physiotherapy patients will be understandably reluctant to visit the hospital setting. It has taken a few weeks to coordinate and systematically work our way through the large number of patients who had their appointments cancelled, and this work is ongoing. If patients require further follow-up, they are placed back on the recall list for further progression of treatment at the appropriate time frame and reviewed accordingly.
As well as providing treatment for patients currently in the physiotherapy service, our routine waiting list also has a significant number of patients waiting to access it. We're beginning to brainstorm future ways of working, learning from new opportunities that have presented themselves during the COVID crisis. This involves embracing the use of technology for virtual physiotherapy sessions, continuation of our telehealth service, and improving online access to physiotherapy resources and tools for patients. This forward planning will be essential for when restrictions are reduced and the physiotherapy MSK service in the Southern Trust to step back up again. Thank you for watching this video. We encourage everyone to continue to adhere to advice and stay safe.